this trial was called, or this study was called, the CAPLA 1000 project. And this is very useful and very helpful data because it provides us with the largest sample on caplacizumab to date. With the clinical trials, the Hercules and the Titan trial, in addition to the positive outcomes and the shortening of the duration of the disease, however, there wasn't a mortality benefit that was demonstrated, meaning it didn't seem in those study populations that death was impacted. However, there was interest in further studying this outcome in subsequent analysis. And there was a subsequent analysis that pooled the two studies together and did demonstrate a mortality benefit. But now we have a much larger data set, which is the CAPLA 1000 project. This was published in the Lancet eClinical Medicine a few months ago this year. So this is brand new data. And in this study, they had 1,015 patients who were treated with caplacizumab in addition to standard of care compared with historic controls. So these are patients who were treated with plasma exchange and steroids, some with rituximab, some not, but not caplacizumab. And so with this analysis, what the authors found was that there was, in fact, a survival benefit. They demonstrated a 98.5% versus 94% in the caplacizumab arm versus the control arm, which met statistical significance. So with this large study sample, there was a survival benefit that was demonstrated. And in addition to that, there was a significant reduction in other very important outcomes, including disease exacerbation, disease refractoriness, the number of plasma exchange sessions, as well as the time to response. So the authors concluded that the early addition of caplacizumab to plasma exchange and immunosuppression significantly reduced unfavorable outcomes, including death, as well as alleviating the burden of care related to immune TTP.